order the March 15th Clallam County Board of Health meeting. Cheryl, can we please have roll call?
Mike Chapman.
Here.
Jeanne LaBrecque.
Here.
Don Lawley.
Here.
Bryon Monohon.
Here.
Mark Ozias.
Here.
Bill Peach.
Here.
Dr. Jeanette Stehr-Green.
Here. Great, it's really wonderful to have a full table today. We're really happy to have our Forks contingent here as well. The first thing on our agenda is the agenda review and approval.
Move to approve. Second.
It's been moved and seconded to approve the agenda as written. Is there any discussion? It's been moved and seconded. All in favor of approving the agenda as written, say aye.
Aye.
All opposed, the same. Thank you very much. Approval of minutes from the February 16th meeting. Thank you, Cheryl, for getting these out to the group. Do we have a motion to approve the minutes?
So moved.
Second. It's been moved and seconded to approve the minutes from February 16th. Is there any discussion? Great. Well, it's been moved and seconded. All in favor of approving the minutes as written, say aye.
Aye.
All opposed, the same. Thank you. Do we have any introductions first? Then we will move on to public comment. And are there individuals who have asked to speak?
I'd like to share that I had a conversation with some folks with regard to dry creek water system, and I think this goes to the conversation we're going to be having about septics and waters. And so, is Cindy here?
I am.
And Cindy, the fellow that we were with, or at least we had a conversation, Eddie Martin, is he here? So when it's your turn, I just wanted to introduce Cindy as one of the people that I talked to about the dry creek water system.
Oh, okay. All right. Thank you for being
I'd like
here.
to make some public comments before that.
Oh, okay. Well, very good. And you're Cindy Kelly?
I am.
Okay, great. Then if there are no other introductions, we'll move on to public comment. And Cindy, you're first on the list. And Paige, you were the other person. Sorry, my apologies.
Hi, my name
Please
is
state your name and your address.
Okay. Cindy Kelly, 2830 West Edgewood Drive, Port Angeles. And I'm currently the manager of Dry Creek Water, and I've been there 27 years. And I have two items I'd like to speak about today. The first would be the meeting that you held on February 16, 2016, where Resolution 1, 2016 was passed and adopted by the members of this committee. As I reviewed your bylaws, page 3, Article 8, Section 1, meetings open to the public states, regular and special meetings of the board and board committees shall be open to the public in accordance with RCW 4230. As I reviewed RCW 4230, you violated RCW 4230-077 and RCW 4230-060 in relation to changing your agenda and without notification to the public that you would be taking action on resolution number 1. While I know that the language including this adopted resolution states that Clallam County Board of Health endorses county community water fluoridation, this resolution is widespread and includes community water fluoridation. While many of our public water systems have elected officials who govern policies, procedures, rules, and regulations, we feel that possibly the water purveyors in this county should have been notified of this proposed action. 10 years ago, Dry Creek Water Association Board of Trustees surveyed their shareholders to see if they wanted fluoridated water added to their system. They did not, so they closed the issue. While we have 17,355 Group A and Group B water systems in our state, according to Washington State Department of Health website, only 51 systems across our state add fluoride chemical. While there is natural fluoride within our systems, I have reviewed the data on the Washington State Department of Health website, Century Internet, which it's called, which I reviewed 13 water systems from Squim to Forks, including Clallam Bay and CQ. I reviewed their inorganic chemical data, IOCs, looking at their levels of fluoride. While you will note that only 2 of our public water systems are currently adding fluoride chemical in our county. Last Wednesday, Washington State Department of Health adopted proposed changes to WAC 246, 290, 460, fluoridation of drinking water. The new rules reduces the current range of operation to 0.5 to 0.9 mgl from the current 0.08 to 1.3 mgl. As you will see in the data that I have provided to you in the spreadsheet, Most of our water systems have 0.5 mgl in our systems without adding a fluoride chemical. Public health is very important to all of us, and we appreciate our two others within our county while discussing these important issues that pertain to our current and future generations. So I'm going to give you some data, and so this data is open. I don't know if you want me just to give it to Cheryl and she'll give it to you, or you want
No, you can hand it out right now. if you'd like. Thank you.
Okay. Too many papers. There we go. So let's kind of walk you through this just for a few minutes. Sure, I don't know if I'm up here, but I will pass on more things we need to know. I will pass on more. I have more to give to the public when I'm done. So the first page you will see, is everybody has a copy? I'm sorry, I'm taking more than 3 minutes here. Is the water system stats according to Department of Health, where I just told you how many systems. So Group A systems are governed by Department of Health. Group B systems in some counties are governed by the county, but I don't think our county's ever adopted any regulations regarding Group B systems. And why Commissioner Peach and I had talked about this issue regarding public water, we do know some wells are drying up, and some of them are drinking from creeks, which is kind of disturbing a little bit, because we know it goes on creeks. And the second system would be all the Group A systems, so like Dry Creek Water is a Group A system. Most of all the systems in the county, except for small systems, are Group B systems. Then you'll see the centric internet stuff, and that is all open to the public. You can go in and you can write either their ID number, and you'll see on the data that I provided to you that I wrote their ID number, and I also wrote the system number. So what I did is I went back and tried to go back as far as I could do in the database, and you can see I went from Sunland. Evergreen would be Bell Hill. Solmar would be between McDonald Creek and Squim, or Carlsberg. Bryon Heights is in Port Angeles. Hurricane Ridge, I took some of the National Park Service water systems because the data is there for that. City of Port Angeles, Black Diamond, Dry Creek Water, Owa Place, Homeowners Association, which is on Place Road. Crescent Water, Lake Crescent, which would be the Park Service, Clallam Bay, CQ, and Forks. So when you would see that some systems haven't did their IOCs lately, but you can see by looking at the data what kind of natural fluoride there already is currently in our system. So that would be something that would be interesting for the county to review. And if you have any questions, please feel free to contact me. Thank you very much.
Thank you. Please state your full name and address.
Good afternoon. I'm Kai Alberg, 4513 Mount Pleasant Road, Port Angeles. I understand that this year you might take up the possibility of imposing a fee on private septic systems in the county, in addition to any already existing inspection requirements. I respectfully request that you carefully tailor any fee proposal as narrowly as possible to the actual problem, and only if a problem is identified beyond any doubt. Owners of working septic systems should not have to pay to remedy the costs or damage occasioned by other systems with problems. If there's a problem on the Miller Peninsula, for example, there's no need to punish all property owners in the county with an additional fee. If a proposal for a septic system fee should be forthcoming from you this year, I hope that you will articulate what specific problem is designed to address, how the funds raised will solve that problem, and what has changed, how that problem has become worse since the time that no septic system fee was deemed necessary. I'd also like to take this opportunity to comment on your action at last month's meeting in passing Resolution 1-2016, endorsing community water fluoridation. The previous speaker has ably stated the points that address my doubts whether it was a really good idea to take up such a controversial subject and pass a resolution on it without any ability of the public to weigh in, since the public had no way of knowing that this issue would be addressed, so I will not repeat those points. I would like to add that I very much hope that this was just a feel-good resolution that will not have any future practical effect in the direction of mandating forced fluoridation of any public or private water supply in the county. While your resolution makes it appear like there's a worldwide consensus for support for forced fluoridation of drinking water, you do not mention that 97% of the Western European population does not consume fluoridated water, and that some countries are taking active measures to remove naturally occurring fluoride from their drinking water because of the health problems that can cause. However, the most important argument against forced fluoridation of drinking water is that of individual autonomy and informed consent. Some of you have a medical background. You know that, except in very limited circumstances, it is unethical to force a patient to consume a drug against his or her will, no matter how strong the medical consensus is that it would clearly be in the patient's interest. The FDA has declared unequivocally in the year 2000 that fluoride, when used in the prevention of disease, is a drug. No matter how convinced you are of the correctness of your scientific knowledge and of the experts you rely on, it would be morally wrong for you to force your neighbor to swallow something against his or her will. Thank you for your consideration.
Thank you. Was there anyone else who was in the audience who didn't sign up and would like to speak at this point?
Eddie?
I think my concerns have been pretty well addressed by the last two speakers. I would like to mention simply that we were told,
She's going to bring you up.
we were told in the year 2003 that there was a great lack of fluoride in our natural water. As Cindy Kelly has shown you presently, that was not exactly the truth. You were also told that there would be a great benefit from putting fluoride in the water for the sake of children. And yet, the decision makers at that time were given the information that fluoride did help children, and the issue was in forks. 50 years of fluoridation in forks, and those kids had worse cavities than the unfluoridated children, and that holds true to this day. I'll be bringing more of this information to you later. Thank you.
Was there anyone else who wanted to speak? Back to the lady with the camera there. It's sound and camera. And I'm just going to let you guys sign in there because I didn't see your name on there. So please sign in. Anybody else wishing to speak during the public comment period? All right.
Madam Chair, Cindy, did you want to speak on the dry creek issue that we talked about?
Well, I think I kind of spoke a little bit, Bill, but if you want to speak.
Well, the issue that, we're going to be discussing septic systems.
Okay.
This is a classic example of an individual, and he's not here. I don't know how old Eddie is, 80, 90? Slow, he's probably still on the way in right now. But that's all it is. But the issue that I want to share with you is that Eddie's water source has been pirated, in his opinion. In fact, the other people that are taking water also have septic systems that may or may not be in compliance. And so Eddie came to me and said, can I have some help here? And that's the reason I've invited him to come and speak here. You're more familiar with the issue than I. Is this indicative of a larger problem? Is it just dry creek?
Cindy Kelly, manager, Dry Creek Water, 3671 West Edgewood Drive. So, since the dams have come out, and we don't know if that's, correlation or what, we've had 2 people up in Blair's Corner that have lost their wells. We've had a few people down the lower Omaha and the area of Christmas Tree Lane who've lost their wells. It becomes more and more, or if they haven't lost their well, they may be only having like a little bit of water coming up. So, like we looked up a new gentleman last week that said that he had enough to get in the shower, wet himself down, turn the water off, and then wait for the burst to come and then get the shampoo out of his hair. So anyway, I'm like, wow. So we don't know, we're starting to see more and more of this. Eddie lives about a half a mile west of Blair's Corner. Dry Creek Water goes across the intersection of 101 and 112 and stops there before you get to the Hanson Road going west. So he and his neighbors, he's surveyed some of his neighbors, but as Commissioner Peach said, he has some, he's getting older, and some of his people said they're going to drill a new well, or they'd like to look at possibly getting some public water or something. But I think probably, 52 years ago when Dry Creek was built, probably wasn't that big of a deal. He did say to me that the previous manager before me, Mrs. Coffey, told him he was a fool for not hooking to the water system then. But, he said his well was pretty good then. So anyway, but he did tell me that a lot of his neighbors are drinking from creeks, which it's a little concerning. And so I said, I hope you're boiling the water. So Mr. Commissioner Peach and I talked, and we're looking at a list of people, maybe to have a public meeting at our Grange to send out asking people in the area who may not have or having problems with their wells, just to see what the survey kind of looks like. But I think the overall bigger problem we have in our county is the infrastructure. And one thing that's probably not your venue to deal with, but I did talk to the economic development person who, Commissioner Peach thought that there was an infrastructure report done, which there's not a report done, but I wrote an email to the commissioners last September telling them that we really need to look at infrastructure in our county and really start looking at how we're going to get some of that built, because we don't just go put a business here and then find out later, well, there's no infrastructure there. That doesn't make good planning. And so it'd be really good for all of us and proactive to do that across our county. To look at, we all have a little bit of capital money, but maybe on a wider scale, that we try to get more infrastructure built for community people across our county, even for public health or for economic development, or just comfort of living, people who don't have internet. I know that's still going on at Nia Bay, through some of our schools still don't have some internet connections, so anyway, thank you.
Thanks, Cindy.
Do you think she represented the gentleman adequately?
Yeah, and I was very pleased. I had some assistance from courthouse staff to get the addresses of everybody within a half mile for the purpose of having a community meeting. And Cindy's working at inviting all of those people to sit and talk. To me, it's an example of, here's a specific location that could have some issues with their septic that I think we ought to take a look at, as opposed to saying, it's a carte blanche across the county type of issue.
Thanks for bringing that to our attention. Anyone else wishing to speak? Then I think we'll move on to the Board of Health member discussion action items. And number one is just a listing of the priorities that we have discussed previously, starting back in December. It's not there that we're going to say anything specific under number one today, but just to remind us that we said these things are important to us, and if they're important, then we need to keep on coming back to them. And if nothing else, I'm going to list them on every agenda from now until December. But I don't know if anybody wants to say anything about those in particular under number one. We have some specific presentations, though, otherwise. Under number two, we had some discussion come forward after last month's meeting about the addition of perhaps some other priorities to our list. And the first was related to mental health, that came from Iva Burks, and the second was vaccine preventable diseases, brought forward by Jeanne LaBrecque. Iva, do you want to join us and kind of lead off that discussion and why you brought it to us for consideration?
Yes. Thank you. I brought it up because it was one of the 6 identified needs in our community health assessment that was done in 2013. So I felt when you were naming them, you kind of forgot this very important section. So I just ask that you do consider. We have made some movement on that, but there are still many, many needs in the mental health area, as there are, of course, on the other identified needs you have.
Are there any thoughts that anyone on the board wants to share with response to that?
I think it's important that we become more cognizant of the current status. We saw recently in PDM the issue with the behavioral health providers having potential problems because they are the ones that are having to underwrite the prolonged acute hospital stays when individuals really need to be hospitalized in a more therapeutic setting for psychiatric care. They said they have reserves and possibly they can get through it, but we also know that the effort of the state to take the current system and put it into a capitated system and yet again look at rearranging that. How do we, again, to the point, infrastructure for the whole county, look at this, because we do have this challenge, and this challenge is not separate from the opioid problem. Typically, you find, and I don't know the statistic today, but 50-50% of individuals who have a addictive problem also may have a mental health problem, and people with mental health problems typically will have could have an addiction problem as well. So this is not an isolated incident. So I would say that we need to keep it kind of on our priority list, and we need to be understanding of where we are and perhaps what are some of the external impacts that are going to hit us, because I think that some of the efforts of the state to further garner additional money, although they've been recently called upon to figure out what the heck they're going to do with provision of care for individuals who do need to have some inpatient stays. That's not happening anytime soon, but we need to be aware of this, and we need to be cognizant of it. So it's not in isolation. I would support making it a priority.
Other thoughts?
This is clearly a very challenging issue that's evolving all the time. I think that the Board of Health needs to make sure that we're as up to date as possible with how things are progressing. But I'm not sure yet if what we can do to help. So I think that we need to we do need to keep tabs on it, but with a special emphasis on what can we actually do to help facilitate that transition. And just as a general comment about the priorities, I don't mind having all the priorities on here, but it's too many. We're not going to hit all of them, and sometimes having so many when we really only are going to have the energy to focus on a few might dilute our focus. So let's leave it at that right now.
When we, can I ask a question, and I appreciate, we shouldn't have, it's not all a priority, everything's on the list, so we obviously have to be more discerning. But that said, do we want actionable items on the priority list, or do we want informational items on the priority list? And are those two separate categorizations?
We kind of talked around that issue, and I think you're the one who actually led it. Well, I think you were here, and you were saying that you felt that it should be more actionable items on the priority list. I mean, you certainly want to hear about all these things and should ask staff and others to bring them back to us. But to me, the priorities is that we were going to try to make a difference in those arenas. And so focusing our efforts, I mean, we don't have a lot of time or funds or anything like that. Obviously, I think focusing is an important aspect of that, and I would agree with Commissioner Ozias that too many priorities, we probably aren't going to be able to address them or do any of them justice. So
maybe today we can hear about the two proposed additions. We'll get a sense for how this champion effort works or not. Perhaps next month we can spend some time focusing in on what the right priorities are for us this year. That would be my suggestion.
is that acceptable to everyone? Yes. Then I think we'll just kind of leave that loosely hanging right there. This is something new for the board. We really haven't had priorities in the past, and it would be great if we could make some traction on some of these areas. So we'll learn as we go along. So with that having been said, we want to talk about the vaccine preventable disease.
Well, obviously last year we were, and perhaps not all of us, but the staff and the interim medical health officer were significantly engaged in the effort with the measles outbreak and epidemic. And there was talk then at that time and work with the school health nurses to document the children's either immunization status or their status where they had requested an exemption. And there was a lot of effort, a lot of time put into that, and we were looking at how or if we could increase the rate of immunizations within the county or make sure that everybody had their exemption if they chose not so to be immunized. That said, we kind of let that go by the wayside, and then just recently, I think it was in the Seattle Times, where they came back again and referenced the measles epidemic here, the unfortunate death that we had because of that. And then I think, I don't know if there was, Chris, I don't care, was there another case in the state? I know it's not in Clallam, but there, I know in California there were some. So it just brought that back to mind that we were very engaged last year. The staff was engaged, and I don't know where we are with the school health nurses. So I put this back out here again, and maybe we just need to have some sort of a status update or some way of tracking or understanding the current levels of immunization rates as opposed to necessarily engaging. I know we did some funky things at the fair with spots and cows.
That's pretty cool.
Yeah.
I liked it.
But I just think we shouldn't, this is just something, we do report communicable diseases, but I don't know what else we can do just to bring this to the forefront. Maybe that's all we want. But.
Thank you.
It seems like clearly vaccine preventable diseases are a part of the foundational public health services that every health jurisdiction is expected to provide. I do have more information about what has been happening behind the scenes in terms of trying to figure out where we're at with the school districts in terms of accurate record keeping and knowledge of exemptions in case there was an outbreak of another vaccine preventable disease. Probably a pretty full agenda. I don't want to take too much time, but if we wanted to circle back to it at some point, I'd be happy to give a status update. The short answer is I think that eventually there's going to need to be a better system of keeping track of immunizations in the state. And hopefully the supplemental budget is going to slide through here, and that it does look like the state budget has about a $500,000 set aside to try to bolster up the IT structure around immunizations. Because we've done a quick audit with the excellent cooperation of the SQUIM school district, looking at a lot of the data that's there, and even with very engaged school nurses and very diligent school district, it's still hard to keep everything straight. It's a ton of kids, all kinds of paper forms back and forth, lots of people, having parents filling them out. And so it's not a straightforward system, and we don't have a good IT infrastructure in Washington State for this right now, but I'm hoping that's going to improve. So that's my short answer. It's not that short.
So this may be an item that we want to keep tabs on, and if there is some way to support, or should there be funds coming down, how do those funds get directed to the most effective point as opposed to...
This would seem like an area, though, that there's great interest within the health department and people that is their task. They're designated to give vaccinations and to work with the schools and that sort of thing. And so I think that there's already a lot happening there, and I would lean toward us keeping tabs on what they're doing. If we're focusing on school age. Now, back during the measles outbreak, we were looking at all age groups and saying everybody needed to be vaccinated. And then that's kind of a wider net, which would probably fall outside of the purview of what's already been done. So it kind of depends on what we're talking about.
So maybe an update, and we can spend some time there and maybe track it, but we certainly have to be looking at what's an effective outreach program. In some way of us keeping tabs on the status, but to Chris's point, the IT system doesn't lend itself to ready data.
Okay, well, thanks. We will just kind of keep those about, though, and continue to mull them over. We're going to kind of circle back to two of the items that were on our priorities, and one I think is going to be a relatively short update, and hopefully Commissioner Peach, you can share with us the latest as far as Washington legislative issues related to nicotine and vaping in particular.
Yeah, the bill that I've been watching is House Bill 1645. If you ever have an interest in following any of this, I suggest you look at a website, leg.wa.gov. This particular legislation dealing with vaping hasn't been passed yet. I talked to some folks that have been following the legislation right before this meeting. The likelihood that the governor is going to call a special session tomorrow is quite probable. And this will be one of the pieces of legislation. Has had a tremendous amount of attention. Unfortunately, it's also had attention from people that would like to see more vaping equipment sold. A bunch of people that are standing in the way of caring for young children. One of those was a piece of legislation that was like 95% tax, rather than the approach this takes is if you're under 21, you're just not authorized. So it sounds like it has solid support, but we won't really know until the special session is initiated. And just looking at the history on it, it has had quite a fair amount of hearings, and I'm optimistic that it'll make it through. You know, we talked about the idea of monitoring some things, and I brought up the mental health issue, a little bit off the topic of nicotine, but there was a piece of legislation that was passed, Senate Bill 6430, that has a lot of potential impact for us in Clallam County. This was to take care of the situation where a person that went to prison, when they leave prison, are able to access their Medicaid. The way the system works today is that's discontinued as soon as they enter the prison system. We have Clallam Bay. And so what this will do is the person that had access to it prior to incarceration will have access to it after incarceration. And the issue is the person that really needed this help may not be, organized well enough to initiate reaching out for that kind of assistance, whereas that whole bureaucratic process of being authorized is now eliminated through this. But it's an example. I have mental health. There are people that will benefit from this that leave the institutions. And I guess what I toss out is this might be something for us to follow to answer the question, what's being done to inform that person leaving the penitentiary that this benefit is available? I can't think of other ways for us to follow up other than share with people that provide that kind of counseling. But just as an idea, it's not necessarily, as an action item, it's simply monitor this and then actually see, did it get implemented?
Is this bill specific to the fact that the Medicaid eligibility picks up and continues, or does it speak to any of what you just talked about, the need for the correctional facilities to engage in some sort of a discharge informational type thing? Does the bill have to cover any of that, or it just speaks to the eligibility continuation?
It's just the eligibility. I think it made it through the system because there isn't a real cost. It's not as though they were asking for money. But I had a chance, and it was Representative Thuringer. I had a good conversation with him and asking him to support this. For us in Clallam County, with what we have at Clallam Bay, this, I think, is an opportunity for us to reach out and help people that need that kind of service.
It's good to bring it to our attention. In talking about the vaping bill, and I'm glad to see that it's still alive, do you sense that it would be helpful for us to write a letter to our representatives saying to support this, or is that... We can't do much, but...
Yeah, and I'd suggest, it actually there's 16 different representatives that are sponsoring the bill right off the bat. That's popular. That one of them is Representative Thuringer, and I talked to him while he was in session, and just even a quick email. That we really do appreciate his support for this. I think it would help.
Well, I would be willing to either email him or draft a letter on behalf of the board. It seems like it needs to be rather timely, though. So I don't think it can wait for your review the next meeting. How should we proceed with that? Suggestions?
My thought would be that individual members of the Board of Health can get in touch with Representative Therenger this afternoon by email or phone.
Okay.
To let him know, and that way, he'll probably hear more opinions rather than just one.
Okay. That seems very reasonable. Then I would encourage all board members to either email or call our legislative representative, Steve Therenger, and share your thoughts with it. The board has actually put nicotine as one of its priority areas just because one of the things was the concern about the lack of control over a sale of vaping equipment to youth and others at a time that they're both very vulnerable to become addicted to nicotine. So, but as you're writing your own email or talking to him, you can share your opinion. Great. Anything else from you, Commissioner Beach? Thank you so much for keeping us abreast of those things. Okay, so now we're gonna try it out. We're going to address in full fashion the nutrition and chronic illness priority, and I will turn it over to you, Mark. You can introduce Dr. Dixon.
Well, thank you. And for those in the audience, the Board of Health is trying something a little bit new this year, which is using a model of looking at the priorities, and if a member of the Board of Health identifies one of those as something that they would like to champion or help push the conversation forward, that might be a way to help the group focus and get something done. So this is the first time that we've tried to do something like this. I'd like to introduce both to the board and to the audience Dr. Monica Dixon. Dr. Dixon and I have been working together on nutrition and chronic health related issues in the Scranton-Dungeness area for the last year and a half or so. She's a very knowledgeable expert professional and is going to help us understand today a little bit more about the landscape here in Washington State as it relates to nutrition and chronic disease. So with that, I will stop butchering your resume and turn it over to you. Thank you for being here, Monica.
Thank you, Mark. And you didn't tell me that this was the first time you guys have ever done this. So we'll see how it rolls. I am honored and thrilled to be here and share a little bit with you the lens through which I see the world. I have been working in nutrition policy across the United States for the last 15 years, principally also with the Center for Disease Control, working in Washington State on our obesity funding, on our community transformation grants, and at the regional and local level. So my goal today is to share with you, in part, why nutrition forms the foundation of so many of your other health problems in general and our community priorities. So I want to go back to what our great, you have to be in the view of this, I think she said. What our, okay, Monica, there we go. Maslow, everybody remember Maslow? We often forget Maslow's hierarchy of needs, but what Maslow reminds us is that fresh air, fresh water, and good food form the foundation of our lives. In fact, there is nothing more important than meeting these needs. I tell people often I get the best job in the world because I get to help teach them how to eat and what to eat as a registered dietitian. But the food system helps build all of these other things. My friends in physical activity will tell me, oh, Monica, physical activity and exercise is very important. Yes, it is. However, most people may be unable to do that if they have not eaten well or if they don't have their health. Let's see. Oh, here we go. Leading contributors to premature death. Why is nutrition so important? We see that diet fits in 6 of these top 10 diseases. So diet is directly related and the largest contributor to premature death. And I'm not going to go through your statistics, but we know in Clallam County, premature death is one of our issues. High blood pressure, high body mass index, physical activity, high total cholesterol, and to a degree even alcohol and drug abuse are related directly to what people eat. Leading causes of death, again, 6 of the top 10 are directly related to nutrition. And the typical medical school has 3 credits of nutrition information. Given that this is such a fundamental priority, that it's a foundation of so many of these different things, it is imperative that we think about what we eat and what our citizens are eating. Here were the 2013 priorities, and I see that those have changed some, but what's fascinating is even the state has placed early learning, healthy parenting skills, and nutrition as one of their top priorities. It is related to substance abuse. I'm a psychologist. I have my foot in 2 worlds, nutrition and psychology. The psychology literature is full of information about how poor nutrition feeds mental health and depression. Medical home availability, no. Chronic disease prevention and management, of course. Mental health, yes. Outpatient services, no. And oral health and dental access. Oral health very much related to people's diets and what they're eating. Healthcare costs $8,900 a person. I think what's fascinating about the CDC statistic here is if we can make a 1% reduction in health issue risks like weight, blood pressure, glucose, cholesterol, we can save $83 to $103 a person in medical costs. And as we know, medical costs continue to rise in large part because we are a nation that is way overfed and far undernourished. So it's not about getting food per se, as it is quality of food. Mark and I had issues with the Swim Food Bank Board at a time trying to work through the fact that just giving food to fill tummies is not always enough and is not necessarily good nutrition. Ramen may not be an adequate food to help people manage all of the world problems that we've got nowadays. Food is central to community building, which is central to solving our worst woes. Have you ever thought about food being central to community building? In public health, we go out and we talk about epidemiology and food insecurity, and we throw all these terminology around. And yet we found that the words that resonate with our citizens are casseroles. Because in our neighborhoods, they don't care about all those public health terms. What they care about is the opportunity to learn how to make a casserole and to make it better and to share it with others. In fact, one of the biggest projects that has been successful across the United States is using faith-based communities, churches, pastors, ministers to impart good nutrition within their own population. And in the southeast, this has been amazing, some of the things that have happened. But community building, I'm going to show you actually a couple pictures later on of how that works. Okay. Some of you are aware of this. I want to point it out for those of you who have not seen this before. This is called the socio-ecological model, which the Center for Disease Control asked us to start working on about 15 years ago. We figured out that if you take a dietitian and you put me in an office with an overweight person and we spend the next 6 weeks working together one-on-one, we're going to have a very minimal impact. If that person goes to a talks meeting and there's 12 people there, we may be able to see somewhat more of an impact, but it is still minor when we have 70% of our population overweight. 70%, so 2/3 of our population. So what the Center for Disease Control started working with us on at the state of Washington was that we look at the socio-ecological model. In fact, that we work at each and every level. So what I have worked with in a large degree have been this community and structures and systems thing. And that's what we're going to talk about more today, how in Clallam County we can help impact that. It doesn't mean this isn't important and that this isn't where change begins, but we want to make an environment here in our county that makes it easier to be able to eat well. So, why does access to healthy food matter? What do some of you think?
If you don't have access, you won't eat healthy.
If you don't have access, okay, access implies all kinds of things, like transportation. Do we have a food desert? Is it greater than 12 miles to get to a grocery store? Or are you buying your food at the local convenience store? Which of course we all know convenience stores are usually pathetic for having good healthy choices available at them. So access is this much bigger issue in the socio-ecological model. And that is one of the things we want to look at here. This is going to be the only nutrition education slide I share with you today. But I use it because it is so impactful in reminding us how important access to healthy food is. Okay, so what I've done here is a schematic that shows what happens to us when we eat particularly different foods. Carbohydrates, complex carbs, protein, and fat. If a child, and I'm going to take two ends of the continuum, a child who is a kindergartner and somebody who is an employee at one of our work sites. At 8 a.m., they have a Pop-Tart, a very high sugared food. We see what happens with this. A very rapid rise in their blood sugar. This lasts somewhere between a half an hour and 45 minutes, and then a very rapid drop to down here. What happens to this child is at 9 a.m. in the morning, they are not available for learning, which is why the school breakfast program has been such a big deal in the state of Washington. What happens right here is very interesting. That poor little pancreas pumps out all kinds of insulin to put away those carbohydrates, and it actually puts away a few more than it needs to, just in case. And so our blood sugar drops a little bit lower than it was before eating. If this were a person in a work site, what we see across the board with them is that they are at the vending machine looking for something sugary, okay, because they want to renew that blood sugar. However, if this person were to eat a complex carbohydrate, we would see 45 minutes later it begins to digest much slower. Let's just say it's a good whole grain bagel, and that's all they had. It would give them at least good stable energy till 10 a.m. However, if they were to put protein on that, or peanut butter on that bagel, including fat, which doesn't begin to digest till about 9:30 when it starts to hit the small intestine, we would see a much longer, much more sustained energy levels in that person. This is why, even though we talk about heart disease and stroke and all those long-range things that people could care less about, their eyes glaze over, when I talk to people about how what you eat this morning for breakfast is going to impact you at noon, that's what matters. What are our kids getting? We can have the best schools in the world, but if they aren't eating a good breakfast balanced with these different things, they aren't available to learn. Neither is the employer who on Friday rewards his employees with a great big plate of Krispy Kremes. So, let's look at what's going on at the state level in policy. many different things, pockets of work all over. The state has put most of their energy into what we were just talking about. OSPI, the Department of Early Learning, and BOH are trying to integrate nutrition and physical activity standards into all of our early learning things because, and that was one of our priorities in our county, because they know how impactful that can be to these kids. Second is the work that comes out of Governor Inslee, Healthiest Next Generation. DOH and OSPI are working on that. There is a lot of great stuff that's gaining some traction. And again, it is working with kids because we know kids are the way to change. Executive Order 1306, this is fascinating. I got to work on this for the last several years, setting food procurement standards. We have unhealthy foods in our prisons. So we are helping to create additional mental illness problems without having healthy food available to them. When we walked into the Department of Health, on the ground floor were 2 vending machines that were full of Cheetos, Fritos, and Coca-Cola. Drove me nuts. I go out all over the state, tell people to eat well, and then come back to see this happening. Okay, we have Governor Inslee's Food Systems Roundtable. How many of you have heard of this? This is big stuff, and we very much need to be connected to this. This consists of 30 different partners who have worked for 2 years to develop a 25-year roadmap of nutrition policy and the food system in the state of Washington. And finally, we have the ACH, the Accountable Care Hubs, that are population-level health, coming out of the Affordable Care Act, saying it's not wise to spend all of our money in chronic disease management, but to spend more in population health and prevention. And then USDA has come out with this FINI, Food Insecurity Nutrition Incentives, which I would love to see us be a part of. Okay, my first step to you, actionable item, would be to begin to activate as a Board of Health a food system roundtable, policy council, coalition, whatever you want to call it. 6, 7 years ago, when I first moved to Sequim, I participated in a food policy council here. There was a lot of conversation with different people from the food system, but it fell apart. And the reason for that was, I'm certain, because of coalition building, there was no sustaining support. Now, I'm going to make my case to you why I think this is so important for us. Many communities can have food policy councils. Many of them, it's very important to set food policy. However, we have a different situation. Those of you unable to see this, it's the thin thread of a bridge that connects us to the food hubs of the Puget Sound. Should we have anything happen in our in a natural situation, and of course this earthquake is one of them, we need let me back up. I am a board member of the Boys and Girls Club, the Olympic Peninsula, and we met with the Red Cross, and they told us that we were a level 4, meaning at the bottom of the barrel, for when they were going to actually be able to get to us, because we don't have that big population base. So we are to be prepared with 3 to 4 weeks worth of food. I find that a #1 imperative for why we need to work on the food system. Speaking with Patty McManus yesterday from Nash's, she said, Monica, I have 1 week's worth of food for this community. But what we need to do is have lots of people making lots of gardens in their backyards and in community beds so that we have that sustaining ability to get food to our citizens. So that's my #1 argument for a food systems roundtable. #2 is looking at our local food system. It is in disparate pieces. We have a lot of food available, It's not particularly always getting to the right people, and it's not being distributed in the best ways possible. I had the opportunity this fall to spend 6 weeks in 7 countries in the Mediterranean to learn about the Mediterranean diet and Mediterranean food systems. It was amazing. This picture is taken in the Emilia-Romagna region. I was in a factory learning how they make Parmigiano Reggiano and how they pay every single person that works in these factories. The prosciutto factory, we went to the balsamic vinegar in Modena. I got to go to Greece and learn about olive oil production. It was an amazing trip. But what I came back with was this sense of system, how everybody works together, okay? And a core element of everything that keeps their food good, not necessarily cheap, but certainly good food. Okay. Going back to the state level, my next argument for why we need a food systems roundtable is if we have a sustainable coalition or group of people who are working together who have said, I am representing animal livestock production, I'm representing the school districts, I'm representing, et cetera, we are then able to plug into these things. Here's what makes me really sad, because I attend all these meetings down at the state level to work on these projects. This food system roundtable, incorporating 30 different subsectors of the state of Washington, had one person from the Olympic Peninsula attend once. She was from Jefferson County, and she was a farmer, and she gave her input. When I asked DOH this morning, what could we do, number one, that was most important for them to remember us on the peninsula, because you know they always forget, they said, you could send somebody to tell us what your county believes is imperative and what our priorities are. This is going to be active, a live document that people are going to work off for the next 25 years. And we don't have any word in that. So all of these things, though, are able to. I'll show you a couple more examples. This is the FINI award. They gave it out to 88 different farmers markets. We didn't get any. It matches SNAP benefits, dollar for dollar. So it not only helps food access, it helps our economy. But we weren't there to get the funds. Here is just a shot of a page that I found off of healthyfoodaccess.org. These are all grants due very soon that we would be able to plug into if we had a sustainable organization that we could say, we count, we're here, and we would like to write for these. And these are all about building our economic development. Okay, this is me a mile away from here. We hear all the time, oh dear, how are we ever going to make the difference? How are we going to impact? And by the way, all of you know, children will not eat healthy food if given to them. So I said, I'm going to teach a class for our kids at our Boys and Girls Club. And last fall, we set up this super cool saddle bar. I cannot tell you how neat it was. The kids got a little plastic Ziploc container with a screw top. They made their own vinaigrette, shook it around. I gave them Ziploc bags. As you see, they got to make their own salads from the salad bar. 30 children were allowed into my one and only class. We had 90 kids barking at the door wanting to take this class. I had to come back the next day with more help and more food to be able to do it. You know what the staff told me? Monica, I don't know what you did in that room, but we are watching kids eat salads out of Ziploc bags that we have never seen touch a green thing in their life. So this is simply right close up to us. Now, this is me doing a cooking demonstration with the food bank, with Nash, at our swim food bank, with Nash's Organic Produce, before me, they came through the line, they got to watch what I was cooking. Here's the rub. They can't taste it. So the very same organization, our health department, that is mandating chronic disease prevention, or not mandating, but talking about it, also disallows us, on the other hand, from allowing them to taste these foods. Why can't we sit down at the table, Dr. Frank, and discuss how can we keep people safe, but also let them be able to try these foods? This line went on for what, 3 hours, Mark? Okay, these people had never seen kale apple salads with vinaigrette, or this was a stir-fried butternut squash thing with char and stuff. They had never seen anything like it. They're picking the produce, and I'm there teaching them. So the second piece is always cooking skills. It's always about cooking. So we can have it available, we can give them access, but we also need to teach them how to cook. I have 150 grants minimum that are available out there for us to teach cooking, but how can we give people a chance to taste some of these kind of things? Food demos at our farmers markets. Is it always going to kill them if they try this? Could we come to some kind of compromise and figure out how to do that? Because we have a lot of people that would love to help them learn. So the question is, by the latest TED conference on innovations in building a culture of health, who are you willing to work with and what can we co-create? This is the Healthy Living Collaborative in Southwest Washington. I want to just use this as an example of what they've been able to put together. They are doing some amazing work, but look who they've brought to the table to help them. Some great stuff. This was in their annual report this year. Now, here's an example of what we have been able to do, just our small club, by putting together a workhorse group of volunteers. We wrote for the USDA Summer Meals Program grant. Some of you may be aware of what the club does. In 2014, we fed 10,000 summer meals. 10,000. In 2015, we fed 18,000 last year. And now, it has been so successful that we are doing 315 after-school suppers every day. That's at 3:30, the kids eat. And for many of them, that's the last meal before they get to school in the morning for breakfast. We have won the USDA Sunshine Award for the entire West Coast out of 17 states. Our little club has been able to tell the rest of the United States on webinars how we have been so successful with 2.5 staff members in feeding that many children. These are the 4 most important, scientifically supported, community-level policies that we can do. I'm bringing those up just to share with you. These are based in the science, and again, we see the nutrition and physical activity interventions in preschool. Okay, our goals to make the healthy choice the easy choice. There's many, many ways about that. But second, to think about building a culture of health. This does not build a culture of health. When we have a diabetes transposed with a dollar menu from McDonald's. So in our county, are we able to do that? So I want to share with you what KidSAP is doing, very close to us. They are working with the 5210 program, which I'll share with you in a moment. They took this message and here is what they say. The initiative has gone viral in Kitsap County, from parents to schools to the health district and beyond. The 5210 program has impacted all of these different areas. Now, what is the 5210? So let's talk about this for a minute. This is implemented in 36 states. And what it is actually Ready, Set, Go 5210 came out of Mary Bridge. What it means is 5 servings of fruit and vegetables every day. 2 hours or less of recreational screen time, 1 hour physical activity, 0 sugar sweetened beverages. Those are the 4 pieces of science that tell us that are the most effective in decreasing both adult and childhood obesity. It is a social marketing campaign. Many of you are familiar with social marketing. So what it's used for is entree to build policies later. And a lot of times a school will slam the door shut on you if you came in and said that you want to do policy change. However, the Squim School Wellness Task Force, we've been working for the last 6 months. They decided to opt for the 5210 campaign in the schools. The city of Squim last night passed a resolution that they would be a 5210 community because this has the ability to impact so many of our citizens. Again, at the individual level, but what we'll do is build policy out of that change. Back to here, the individual affecting them and going on larger. 5210 I could talk about for a long time because it has a lot of impact. These are just some examples of policy changes that come out of the 4 messages. So social marketing in Kitsap and in Pierce County, this is everywhere. We have put together, Mark was able to find some grant funding last year and build what we have now become called the Healthy Community Coalition, Squim Dungeness Valley. We have representation over the last year. We started a year ago. We now have, these organizations are members of our coalition. We have adopted the 5210 program as in Squim as our first step to be able to build upon that. You will see us in the irrigation parade. We are going to be at Children's Day for the Irrigation Festival. And we are going to continue to educate our chamber and other folks across the community about the 5210 steps. This group decided that Squim was enough. They did not want to go countywide. It was too big for them. But we know that in the future, we may be able to look at a larger group. People say that these changes are difficult to make. It's an uphill battle, and good grief, nobody will ever do this. Well, in 30 years of working in this field, I never imagined that we would have gardens at schools, nor that we would have salad bars available free to give out to schools based on grant funding through several organizations. Who thought that we'd be able to see them making their own? Look at the number of operating farmers markets. This gives me great hope that we are going to eventually be able to turn the tide and build this culture of health that we talked about. We also, 40 and 50 years ago, never believed that Santa Claus would sell cigarettes. Hard to imagine. And yet nowadays, we can't, for the life of us, think about, ask your dentist what they would recommend smoking. That's how much our culture shift has happened. More doctors smoke Camels than any other cigarette. Imagine that. And last but not least, our own president was, back in the day, smoking. It was pervasive everywhere. People said it could never change, but it took a cultural shift. It was in small places throughout many, many years that we were able to see it. The millennials are changing the face of nutrition in America. Whoever thought that McDonald's would be losing their butts in their stock because of companies like Chipotle and fresh foods that are coming along. Those millennials are pushing this change. So, in closing today, I want to ask you to think about nutrition as the core root of many of the things that you do, that both in your personal lives, but in the decisions you make for our citizens, and to consider a food system roundtable to help us plug in and have a voice at the table for all the rest of what's happening in nutrition in our community. Thank you very much. It's been awesome, and I appreciate you giving me so much time to be able to speak to you guys.
Thank you.
Thank you very much.
Does anybody have any questions?
So I have a question for Mark. I think this was a great introduction to this whole topic area. It was a smorgasbord. You were all over the place, getting me excited about this and that, but all over the place. And I think as we talked earlier about these priorities is trying to focus down on doing some things in particular. I think that Monica, Dr. Dixon just shared with us a number of ideas. I'm not sure that we're ready to go forward with any of them, but how about we come back next meeting wanting to talk perhaps about this food systems roundtable. What would that entail? What does that mean? Maybe sharing a little bit more about the experience of other communities that have done that. There were several other things that I took down here. The FINI awards seemed like something that would be very good. And then this whole 5210 program. There might be some others, but could we come back and Mark, I'd ask you to take responsibility for this.
Yes.
These are some concrete ideas and discuss them. Does that seem like a logical next step?
That seems like a logical next step. I'd love, of course, to talk about them next month. If there are other priorities that we need to juggle this in with, then we can certainly talk about that. But I'd be happy to come back next month with some additional information and suggestions for next step.
Okay. Anybody else want to say anything at this point? Again.
I'm just curious as to what happened. I went to one of the food meetings that they had in the Port Angeles Library years ago. It was so this must date from what, 2010? It was well attended. I would guess there were probably 60 people there, and I know they had one more meeting, and after that I lost touch and track of what happened with them. So a little bit of history would be refreshing too, because I know that there was a good solid intent in place.
Okay, so what's happened in the
Yeah,
past?
and Bryon, that was sponsored by the League of Women Voters, and they pulled that group together. The group met twice, if I remember correctly, and there was a lot of conversation around the table, and boy, we should keep doing this, but there was no leader, and there was no organization or institution who was stepped forward to organize and continue the conversation. And so I think if as one possible next step, this group were to look at what would it take to establish a food policy council, or which would pull together perhaps a similar group to that one that happened 5 or 6 years ago. That would be one of the fundamental questions: is who owns that group? This group would have a hard time staying organized without Cheryl's assistance. Any of these advisory committees that operate anywhere need some level of support and some institutional backing in order to maintain longevity. So that's where that one fell through.
Okay.
So we could learn from that experience.
Yes, absolutely.
Great.
Absolutely.
Wonderful. We'll look to fitting it into our next month's agenda.
Perfect.
Wonderful. And thank you again, Dr. Dixon. Appreciate it. Old business and informational items. We don't have anything listed. Was there something?
Madam Chair, I'm sorry, you need to move to the open public hearing that was to start at 2:30.
Okay. Yep. Thank you. Appreciate that. Keeping you on time here. So we will come back to the health officer's report after we have done the environmental health director's report. And Andy, would you like to join us at the table? At this time, we would like to open the public hearing for the drain, rock, sand, and sieve policy. This was shared with us 2 months ago. It was initially reviewed by the Board of Health. There were some questions and concerns. It was brought back last month, and I think there were a few things that were identified, and it was then brought to a draft that we were satisfied with. So,
That's correct.
and it was in our packets again. So,
Well, the board announced a call for a public hearing for adopting this policy, and so it's really up to the board.
okay. Then we will open the public hearing first with asking if there's anyone from the public that would like to comment on the policy. Now, I know that it was publicized through the local media, or you sent out.
It was, and there was an opportunity for the industry folks to also provide comments. We did receive any. I believe we finally got our measurements corrected.
Yes.
So that happened last meeting, and thanks for that. And like I said, it's updating, but it's really not changing the SID analysis, or what we're saying is clean soils and why we need to have clean soils in Drainfield. So it's really, like I said, just an update.
Okay, so it sounds like you have nothing further to add than what we've talked about in the past. It does not appear that you received any public comment, emails, telephone calls about the policy. Is there any further discussion by the board? It was in our packets again. I read through, I actually checked your calculations. You rounded a little differently than I did, but was there any further comment from the board?
Just nice job cleaning up the centimeter, millimeter to the next
Well then, is there a motion to adopt this policy as written?
And Chair, we need to make sure there's no one in the audience.
I'll ask again. Is there anyone here for public comment with regards to the policy, drain rock, sand, and sieve tests? Specifically would like to share their comments. Okay.
So I move that we close the public hearing.
Second.
And now the discussion can lead to a motion. And I'd make that motion
Okay.
to adopt the ordinance prepared for us.
Second.
It has been moved and seconded to adopt the drain rock, sand, and sieves policy, sieve test policy. Is there any further discussion?
Probably should vote on the first motion to close the public hearing before you vote on the ordinance.
I apologize.
No, it's okay. It's just your
He did it in order there, so I thought it was a given. It's been moved and seconded that we would close the public hearing. Again, assuming nobody has come up with any further comments. In the meantime, all in favor of closing the public hearing, say aye.
Aye.
All opposed, the same. So we had another proposal on the table then, a motion on the table to adopt the policy, which was seconded. Is there any further discussion? If there's no further discussion, it's been moved and seconded to adopt this policy as written. All in favor, say aye.
Aye.
All opposed, the same.
So,
Thank you very much. And I appreciate the correction on operations. If you don't mind, we will just continue on with, so why don't you just finish out your part here, and we'll come back to Dr. Frank after you.
Okay, in keeping with the board priorities, discussions on stable funding, I am going to have another presentation today about the on-site management plan and the work group recommendations. And my goal really is to make sure that everyone at the table has a pretty good understanding of all the background information and development that transpired up until this point. That's all I need to start with. It's just as easy for me to be here. So today I'm going to talk a little bit about the on-site septic system management requirements that were developed around 2005 to 2007, and the challenge for homeowners and local health jurisdictions in meeting those mandates. And some of this will be reviewed from last time. So the on-site Department of Health, State Board of Health code basically requires that marine shoreline counties develop some type of a management plan and regulation to govern all the septic systems within the jurisdiction. And that homeowners are responsible to maintain their septic systems and have an inspection done depending on whether they have a conventional gravity system or an alternative system. Counties, marine shoreline counties were to create marine recovery areas where septic systems and shellfish growing areas and possibly nitrogen affected water quality areas were learned. So it was a lot to kind of bite off, I guess, for environmental health to take a look at all those kinds of things. And it wasn't anything we wanted to do in a vacuum. So we really wanted to involve the citizens, industry, and other stakeholders in trying to figure out how to do those things. And at that point in time, we formed a work group and had a facilitator who basically managed the group. This is the composition of the work group. We tried to have a fairly expansive stakeholder work group. These are the actual representatives that were part of that work group. So the work group met between October 2006 and April 2007 specifically to come up with recommendations on the management plan. Before the management plan was finalized, there were two public meetings I remember. There was one in Squim at the Dungeness Schoolhouse, I believe it was, and the other one was at the Forks City Hall, if I remember right. And the outcome was that the work group had recommendations about inspections. And they were saying that the homeowners should have a choice whether they're going to hire someone to do an inspection or to be trained to do their own inspection. And the boundaries of the marine recovery area should be the same as the Squim-Dungeness Watershed Clean Water District, which was formed in the year 2000. Within the MRA, the work group wanted to have the first inspections done by a professional so that there would be a very good baseline of information created as far as the septic systems and what we knew about them before letting a homeowner do their own system after being trained. And as far as trying to get compliance, they suggested that to be focused on education and incentives before we take any type of enforcement actions. Penalties should be a last resort. We did look at risk-based prioritization, and when it comes to having an inspection done and submitting a report, making sure that the reporting requirements are fairly simple, and that the inspections should be done actually by professionals when issuing any type of permits and prior to the transfer of sales of property. As far as financing, the work group recommended that yes, there should be stable funding. They really wanted to see some type of incentive program and low-interest loans for people in need if systems needed to be replaced or repaired, and that for some type of funding mechanism to be created for the county's new responsibilities in tracking all the septic systems in the NRA and also partially countywide. So they looked at these funding mechanisms, and I have not in this presentation because I didn't want to make it really long, but additional slides that go along with each one of these mechanisms, which I will, when the minutes come out, I will make sure that those extra slides are in the minute along with this presentation. But basically, to kind of cut down through it, the group decided on the very bottom that annual operating permits were probably the most practical way to get some type of funding. And so to create this stable funding source, there is a section in the state code and also in RCW that does allow for the Board of Health to have some type of an annual mechanism. The recommendation was that you can think of an operating permit as like a registration, an annual registration similar to what a car registration would be, and that would be charged annually. They recommended some type of a charge between $10 and $20 a year. They wanted it countywide and suggested that the funds could be collected through the property tax statement by the treasurer. To go back to that, there was, I think a few years back, the legislature did specifically allow the treasurer's office to collect those rates and charges for like your registration through the tax statement. So for implementation of the plan, we're going back 9 years, and so we have basically done all these things. In our startup, we've done all of those except for basically establish a funding source. We are pretty much down on the list on our implementation. It's just kind of an ongoing thing now where we're just trying to keep track of septic systems that are inspected. We're required to go out and identify problem systems and make sure that they're fixed. And we have to continue updating our database to make sure that we're current on all these things. And we still have, we're still heavy on education and provide homeowners with septic system information in classes, and also do several classes about how to inspect your own system, as well as maintain a web-based training for septic system owners. So that's the kind of the short version of how the management plan, which I will show you. What the management plan looks like. And it really is, it basically follows a recipe that the Department of Health, and this is what the management plan needs to have. And it basically says what kind of database you're going to use, what kind of information you're going to collect, how you're going to educate homeowners, how you're going to public financing, those kind of things all on here. It's developed in 2007. It is online, so I can put the link. Maybe that's the easiest way. Put the link in the minutes or meeting notes when they come out.
That'd be great.
And everyone can read it there.
Andy, how many properties do you think this impacted?
Countywide, I think we have about 90,000 septic systems countywide. About 19,000 systems countywide, and a little over 12,000 systems in the MRA.
So I know last month, there was talk of moving this forward, and I just throw something out on the Board of Health, and I'm trying to warn you guys, let you know this, you could really get bogged down, but I'll throw something out there. You'll have the votes, the Board of Health could put this in, you could push it through, but I'm telling you, the mood of the public, it won't go good, and you'll get bogged down. That said, what I would offer is if there's roughly 20,000 homes at $10 a home, it's $200,000. County commissioners reinstated the 210 sales tax earlier this year, which is like 4 times that amount on a yearly basis. I think this board could write a letter to the Board of Commissioners asking us to dedicate the $200,000 to environmental health. End of story. You don't get bogged down. You don't upset the community. The money's already coming in. And I think you'd find that that would be a really good solution. Otherwise, you're going to pack this room. You're going to get bogged down. You're going to be in the crosshairs of a large political storm that this board probably, for the volunteers, you guys don't want to get in the middle of that. I think this is an easy fix. I've said many times they need stable funding. The county commissioners should step up. They have the revenue. They have the ability to provide stable funding. And until there's such a need, major recession, massive loss of revenue, counties looking at layoffs, which we're not, this would be exactly one of the reasons why the 2/10 was reenacted. Instead of adding the 2/10 onto the backs of the taxpayers, then adding a $10 or $12 yearly fee, and having the Board of Health now being so political, because that's such a political decision, you guys would be allowed the rest of the year and then the next year to focus on the issues we've been talking about. It would stabilize Andy's funding, and I just think that's a much simpler, easier fix than to go through this process, which I tried to indicate last month probably wouldn't be smooth. I don't think it's good for this board. Most of those decisions were at the commissioner level. This was the only funding. Bryon, hospital commissioner, 2 volunteers. You guys don't need to get bogged down in taxing county people countywide. You don't want that at your level. It's not really what you signed up for. And the pain, the political pain that would cause this board would be untenable, in my opinion. Let the Board of Commissioners do our job. Make sure that we follow through, make sure that Andy and his staff have the stable funding to have the revenue. We took the tough vote earlier this year to reinstate that revenue, and I don't, for one, want to see the taxpayers and the county taxed twice. You may say it's a small amount, $10 here, $12 there. Well, you may say fluoride's a small amount in the water, but when people are frustrated with their government, this is just another thing that adds to that level of frustration. And I just don't think that it would be wise for the Board of Health. So I think that there's, and he's funded this year, we can look at it at the budget time, but to add a fee, a tax, a per parcel property, the county has a revenue. Let's just be honest. Many people testified when we talked about reinstating the sales tax. They wanted to know what we'd be using it for. And in my mind, it was to stave off some of these extra fees that just upset the public. They just cause angst. They just cause distrust with government. We have the revenue. The program is doing good, and Andy can continue to work with the board to be fully funded. Let the commissioners do our job to fund our programs. You guys recommend what programs should be funded. We've done it with WIC. This Board of Health stepped up in the last year and said, hey, can you fund WIC a little bit more? And we did that. You've done that many times. Do not. Look, I'm just speaking from the heart. I don't think it's wise for this board to step in where the commissioners should be, where the people directly responsible, and to do a double whammy in the first quarter of 2016 of a sales tax increase, reinstating that, and that's $1 million that then would be taken out over the next year out of this community.
Well, I appreciate you bringing that up. I think what the board wants is stable funding. So, and I have not heard of this possibility before. Would it make sense to come back to at our next meeting to actually talk about the pros and cons of that. It sounds great to me, but I'm guessing that there is a downside to that as well, and I don't know whether staff or the other commissioners are ready to speak to that, unless you would like to talk about it now.
Well, I just wondered, Mike, I think this sounds like a really very good concept. Is it, you sort of outlined a kind of a plan briefly. Could you maybe do that again? I didn't catch, how much?
I
Obviously, it's
think
going to
we
be the
would
commission.
continue to work with environmental health to make sure that they're fully funded and to backfill it. Last I checked, most of their requests have been funded, but there's new revenue coming in, and we just enacted that. So, and what we could do is, if you wanted to, I think the board could just set aside $200,000 out of the sales tax increase for environmental health. If that's what this you guys could. But I'm just saying.
But that would go to the commissioners.
No, it's a commissioner decision.
Yeah.
Really, any budget and any taxing authority, I don't think this board should do. I think that should be a commissioner's decision. That's not what you guys signed up for. And the difficulty of dealing with the frustration that would boil over from the public should not land on this board. So I think that the commissioners have been and should always continue to maintain budgetary responsibility and taxing and fee responsibility, other than the minor fees for, we do some fees for food inspection and that sort of thing, but those are innocuous. This is a brand new parcel fee, and that's a tough sell, and there's revenue. The county has the revenue to set aside for stable funding for the foreseeable future. And we just took a bunch of revenue back out of the community. So this would be another whammy all within the first, teaming it up. So just my thoughts. I personally wouldn't support the fee at this level. I think it's a commissioner's decision, and I think it's just wrong for the Board of Health to wade in at taxing the public. I just don't think that's what you guys want to be involved in.
But in ensuring that we have these programs, I think that is a Board of Health. So if that's putting the heat on our commissioners to fund it or some other way.
I would argue that they've been pretty funded. And it's up to Andy to mention what else he needs to the Board of Commissioners.
I guess I had not had that same understanding. I thought that they were going from grant to grant, and there was great concern for the ability to continue the good work that has been done.
And nobody wants to stop that good work, but it's the commissioners that can and have the ability to fund that good work. And we have been really successful at getting state grants. And if they dry up, then it's many things. Then the Board of Commissioners will have that budgetary authority, and there are lots of other options that ultimately the Board of Commissioners in the next year or two may have to look at. But you have to remember, one of the arguments about raising the sales taxes with a fairly large reserve. We're not at a crisis mode, and he can get the revenue that he needs. There haven't been drastic budget cuts the last couple of years. In fact, we've bring people back to 40 hours a week. We've added staff. Everybody that's come before the board this year has gotten staff added back to them. So I just don't think it's a need, and there's lots of options for the commissioners to do down the road. I don't think it's this board's responsibility to direct to the commissioners how to fund the programs. It's this board's responsibility to advise the board and say this program is important, this program is important, and this program. But if you go down and start taxing and taking on that on yourself, then this board gets bogged down in an area that's not.
And thank you. We appreciate.
I'm one of
appreciate that.
and I'm probably the outlier here. But
I want to understand the pros and cons of this.
Yeah.
I would like to just understand that option better, and if we're prepared to talk about that and get staff response to whether that's the kind of funding that we need, will that be stable? But other commissioners, Board of Commissioners.
Should I just make a comment? You jump in, but in order to understand, I know it would be off the cuff right now. Come top of mind. But that said, agreeing that if there is a source of funds out there that makes sense, do it. But I still would like to know exactly how those funds would be allocated and spent. So it's like it needs to be a better put together package before we would spend some time just even hearing about it. If the commissioners are open to looking at that release of funds for sustainable funding, still want to know where and how it's going to be used. More so as maybe as a Board of Health, but also as one of those taxpayers or one of the people in the county that this has impact on. So I would like to know a bigger package than what perhaps we can present today.
I
We can
would
have
think
a
so,
viewpoint,
but
we can also have some thoughts, but we don't have the whole thing in front of us.
I would totally agree. It's not something that we would decide upon today, but while it's fresh in everyone's thoughts right now, whether there's any responses to that. Commissioner Peach, Commissioner Ozias.
I'm clearly against any tax increase, and I will vigorously oppose it. But I like the idea of reallocating the budget. Mike's onto it. You know, what is it that we have that's lower priority than doing this? What I don't understand, Andy, is where's the crisis? I don't see it. And so
You know, I think
maybe-
it sounds to me what you're asking for is, what are we doing, what and what do we need, and why and how much stable funding we need.
Right.
So
yes.
to me, I kind of like to
What's
sit
the
down and
gap?
gather my thoughts and put that together.
And that certainly makes sense.
Yeah.
That certainly makes sense.
And
But do you want
I
to say
feel like
anything
we're,
immediately?
yes, we're now moving from conceptual to reality. The concept as identified years ago is we need to identify stable funding, and now we're talking about how to do it. And so, to me, what I wrote down as we were talking, as I was listening to your presentation, is if we were to assess a fee of $10 per parcel, how would that equate to what your need actually is? So, the first question is, if we've identified this as a priority, then what annual financial level of support will be required in order to meet the need? And then I think that Commissioner Chapman is correct in saying that probably the first place to look would be to make your case, and in fact, it could come with the endorsement of the Board of Health to the commissioners. And this is the problem that we're addressing. This is why we're addressing it now, and here's what the need is. Then we would figure out how to meet that. And if, as a Board of Commissioners, if we don't fund it after you've made the pitch, then I'd say the Board of Health would come back around and say, okay, this is still a priority. It's not going to get funded that way, so what's our next step? That's how I would see it playing out.
So it sounds like we need you to come back next month.
Get more homework.
You have more homework to help us better understand the need. What are the funds going to be used for? How much do you need? So on and so forth. However, I also, because I am not a county commissioner, would appreciate understanding this source of funding, because are there concerns about it going away and not being as stable, or reallocation and that sort of thing? Well, anyway, I would like to have that discussion in a more systematic manner, just that other
Here's my
side.
point, you guys. Ultimately, I think it's wrong for this board to get involved in those discussions as far as financing the county. And I think that you're going to get bogged down, and I think you're going to get distracted, and I think it's going to set a bad precedent. I don't think this board wants to go down that road. That's what 3 county commissioners are elected. Those are the tough decisions. Those are the public hearings that we have, that we're experienced. Just like I wouldn't go into Dr. Frank's office and tell him how to conduct public health from a medical. I'm somewhat offended that this board thinks they're going to step in and tell the Board of Commissioners how to fund county government and take on that role. You can do that. There is a part of the law. But I think it's very dangerous and sets a very bad precedent for the simple fact that 2 are volunteer citizens, 2 represent very small jurisdictions, and in essence, the 4 of you could usurp the authority of the county commissioners and the electorate. That's again what I think is a very bad precedent. And once this board took that authority, where would it stop? Because then this board could then step into a lot of areas and really become then a political board, not a board of health, which I don't think. When we wear the hat here, we're here for public health. The 3 of us, and whoever's elected in the future, wears the hat of funding all aspects of county government. And so there are many options for boards and commissioners in the future to put this fee on. There may be a need for a fee, not now, not with the new sales tax and not with the reserves, but someday there may be a need for a fee, and the Board of Commissioners should make that decision. This board, that's outside the purview of this board, in my opinion.
Well, I, for one, appreciate your wise counsel on this, so I think that we should come back next month focusing on that possibility, but then again, hearing from Andy exactly what we're talking about here. And I really appreciate the commitment of our county commissioners to fund this really critical program. It is important, and
And it's funded.
It's funded, but there's always been concerns that those funds would go away, and so this just gives stability. It's stable.
It's funded. It's never been proposed to be on the cuts. In all the years of budget cuts, this program was never on the chopping block. Many other programs, and I don't believe a Board of Commissioners would ever cut environmental. So again, I feel like I'm defending something that has not been the reality.
How much money does the Board of Commissioners put into environmental health right now?
Our administrator was here.
I'm back in the corner, but I don't know the answer off the top of my head. It's
For the
$7 million.
For the most part, the MRA work that we do is funded through grants.
And I'm with you.
And that the...
But it's not funded
for the most part.
But that's not stable. I mean, I think that's a concern as we've seen grants dwindling dramatically in recent years. So I know, I apologize if you've been offended by anything that I've said. You know, I hear the health department staff side of things and concerns about funding. And so it's, although I would agree with you, I don't want to get into the politics of things. I do think that it's a role of the board to help bring attention to possible need, and we don't want any faltering with this critical program. So I appreciate you stepping up and sharing your thoughts, but also sharing a very concrete idea, and we will come back next month and talk further about it. Does that sound right? Unless somebody wants to say something else.
No, that does sound right, and I would just suggest, Andy, that it would be helpful to know whether there are, whether your projections for the ongoing expense of this program, you know, if they're going to be different as time goes on. You know, for example, is there a need for extra funds now because we're at the beginning of the process, which would level out over time? You know, I'm not sure. So you don't have to answer now, but I'd say that it would be helpful for me as a commissioner to have a better sense of what the need is going to, the projected need is going to look like over the course of the next few years, and how that funding is currently maintained. So it will be helpful for me to hear, well, we've been depending on grant funding for this from the Department of so-and-so. However, we're not expecting that that's going to be available next year, so we're rejiggering things. So in other words, the more landscape you can provide, the more helpful it would be.
I agree, and I think that I'd add, Andy works in a very different environment, so does I. You know, their departments are very fluid with regard to their funding. They have staff that actually have on their position identified whether or not, if they don't receive grant funding, whether that position is eliminated. I'm not sure I want to work that way, Andy, but that's the world that you're working.
I'm not sure I want to work in that way either, but that's what I've been given.
And so what I'm sharing, Andy, is that just as you recognize the need for us to benefit all of Clallam County, I can give you a long list of all the programs that are within Ivan's program and others. It's a reality. It really is a reality. And I do believe that as we make the decision, we need to look at, what is it that Andy knows about either our future demands or our funding sources. But if you think the justification is stability, I'd really like to sit down with you during the entire budgeting process. You're only looking at a small portion of, just like what Mike is saying, what we deal with. And it's gut-wrenching, but that's what we get paid to do. And so I'm really interested in what you've got to say, Andy. But for the rest of the board, welcome to our reality.
Yeah.
Does anybody else want to say anything now? We are going to come back to this. Thank you, Andy. Anything else?
No, I just have to put on the record, I would come back to this from the Board of Health perspective. I would have Andy, the Board of Commissioners, do the budget process. I just think this is the wrong way, the wrong place, the wrong time for this board to get involved in budgeting and taxing. It's not the purview of this board. I get on 107, I'm the voice in the wilderness, but I'm two voices in the wilderness.
I'm hearing them crying out there. If you would allow me, I would at least like to hear Andy's laying out of what are the needs, what are the projected needs, and his concerns.
And he can come when he does it to the Board of Commissioners, which is the proper place for that occur. He can schedule a work session, and you all can come and listen, and then it's at the proper venue, which is the Board of Commissioners, and not this board. That is my point. There is a division of labor in the county, and the Board of Commissioners are responsible for taxing and budgetary primarily. And this board is usurping the Board of Commissioners' authority, and that's my objection. Andy, I will give him 2 hours on Monday in a work session, and he can sit with the Board of Commissioners, and members of the Board of Health can come and listen, and staff can come and listen. And then you can come back to this board and say, we'd like to write a letter supporting Andy's request to the Board of Commissioners. But for this board to sit and take on budgetary authority and budgetary decisions is absolutely the wrong place and the wrong way to do it. There's a reason why there's a Board of Commissioners in charge of the county budget.
So I appreciate those words. So then,
I don't think you
my
do,
final,
Jeanette.
actually, I think I do, more than you realize. Andy, you are the staff. You have to help us understand how to move forward on this. Would you prefer to go through the Board of Commissioners? They will give you 2 hours on the work session. Board of Health members can be present.
I'm new, but I wanted to just...
I'd have to object there. That's not fair. Andy is my employee.
Okay.
That's not fair to ask him that question with the commissioners sitting here. I agree with Commissioner Chapman in this regard that you're putting Andy in a really bad spot, and it's just not fair to do that.
And I just wanted to say, I think this came out of a large work group process back in 2007, and it had a ton of stakeholders involved, and this was their recommendation that Andy is presenting. This is not Andy's recommendation.
But they made that presentation back in 2006, and the commission said, the commissioners at that time said, we're not going to raise the fees.
Right, just shut it down.
So, no, they didn't shut it down. They said, let's figure out how to make it work, right? Whether it's by grants or whether it's, I did just look at the budget. It has gone down a little from where it was back when it first started, 2007, 2008, but it's still being funded. If we need more, Andy and Iva are in exactly the right place to say, okay, and Commissioner Chapman's absolutely right. I see your guys' role as being critical in saying this is a high priority for us. We really support the program and think we ought to expand it in somehow. I have not heard one word from Andy or Iva about any expansion, about any money that they have not asked me in the last 3 years for, hey, we're not doing a good enough job on this. If you think they're not doing a good enough job in expanding the program, you really ought to make that recommendation that it be increased. And Commissioner Chapman is exactly right. It is the commissioner's job to take those recommendations from an experienced, learned, important body, advisory body such as the Board of Health, and support staff's request. And I know we can do it. Is it permanent? No, because nothing's permanent.
But there are options for future boards to make it permanent with future boards and determine that that's necessary. That's why you guys, this is not a good place with this board. And you're right, Dr. Frank, you did your work in 2006 and 2007. It was discussed by boards of commissioners, but if you look at the budget history, there have been no draconian cuts. So I think that, once again, it'd be very easy for this board to just put in a tax and not be, and could do it over over the objections of 2 or more commissioners. But that's not the role of this board to do that. And you will forever sully the Board of Health as a nonpartisan, non-political body simply in charge of concerned with public health. You will become a political body so fast that it will forever sully the Board of Health and the ability to do work in this county. You will then be seen as a partisan, political body who did something that boards of commissioners for a decade found other ways to fund the program. I just don't think you want to go there. And I think it would forever change the way the Board of Health is viewed in the public eye. And it's been pretty successful that the Board of Health has been traditionally fairly accepted by the public in the advice that we give here. And there are times, it may seem strange, there have been issues that I voted on as a Board of Health member that I couldn't vote on as a commissioner. That's just the reality. But do not, I just disagree that this board should be looking at budgetary, and Jim's right, bringing Andy into this, a tough spot for him. He answers directly to Ira, who answers directly to Jim, who answers to the commissioners. This is a usurping of authority. The Board of Commissioners will give Andy and Ira all the time they need. We've added staff already this year. Didn't we already give them some staff this year?
In environmental health,
environmental health.
they got some extra hours. We've not any new staff.
We've added staff throughout the county. We can do it, but let the commissioners do it, because we're the ones accountable to the public directly through elections.
And I think that the Board of Health is doing its role right now in elevating the conversation so that we can talk about what's a path toward funding. And if the commissioners don't provide the necessary funding, then you can always come back to the Board of Health. This group can discuss it again and decide, well, what's the next step? Because this is, if the funding isn't there that you need, then it will be an ongoing problem. So then we can decide what a logical next step is. But I would have to agree that right now, I think the logical next step is to say that the Board of Health has recognized that this is a priority and suggested that the commissioners find a way to fund it. It seems real straightforward.
The discussion is important. The discussion needs to occur. I will schedule the necessary meetings with the commissioners, and we'll have those discussions, and we'll lay out a game plan, and we'll listen to Andy, and he'll get a very fair shake. And the Board of Commissioners, I'm confident, whoever they will be, whether this year, next year, or in 5 years, will always find a way to fund environmental health to protect our environment. But that's the process, and that was the objection that I began to raise last month. I'm raising it in an even stronger way, because as I thought about it over the month, I've thought about how fundamentally it will change, like I said, it will change the Board of Health's perception in the community. Let the commissioners do their job. Let's schedule Andy when he's ready. When he's ready, he works with his boss, he works with Jim, he works with me to set the agenda. And then you guys can be notified, and you can weigh in as citizens and advisory board members, as Board of Health members, as doctors, as experts. But let the commissioners do their job on this and protect the Board of Health from a very partisan political process.
So I'd ask the board at this time if there's a general consensus on taking the direction that has been suggested.
I would actually go so far to make the motion basically to what Mike has just stated. I don't know if I could summarize it as well as you, Mike, but I would recommend a motion that we defer the discussions of any fees back to the Board of Commissioners. We will support, advise, provide input, and we'll let them make any decisions in that order. I would make a motion.
I'll second. Let me put this on the record. It is my belief, fundamentally, that in the future, and Jim will agree, Mark will agree, Bill will relatively agree that at some point a fee will have to be probably put in place. But I don't think right now, and I don't think in the same quarter, the same first 3 months where we just brought back $800,000 worth of sales tax is the place or the time to do it. I don't even think next year is the place or the time. I think you're talking another 1 to 2 to 3 years. Eventually, though, the Board of Commissioners, and they'll do their job, and they'll be elected, and they'll have the authority to do it, they'll do their job, and they'll look at this very closely. So nobody should walk away that somehow, the importance of environmental health is paramount. There's If you look at the budget history, it's been paramount. And we can do more. We can do more across the board, and we've done a pretty good job. So that's all I'll say. I appreciate the support, Don, and hope the full board supports the motion.
So it has been moved and seconded that the funding issues with regards to environmental health on-site septic systems program being moved to the Board of Commissioners. They'll be able to weigh in. The Board of Health can certainly witness those discussions and reflect on them and such. Is there any further discussion on that rather lengthy motion? So it's been moved and seconded to move the discussion over to the Board of Commissioners. All in favor say aye.
Aye.
All opposed the same. Thank you very much. I actually find that your very emotional statements and wanting to protect us, I think that's really looking out for the best interest of the board, but I also think that you've impressed upon me the feelings amongst the commissioners that this is a critical program and a priority, and you received our message too. Thank you very much.
And I think the board has been clear over the years. I don't think we've studied Andy or public health, and we've added.
And this is where some of us just aren't privy of everything, but I've sat on this board for more than 12 years, and it's been an issue that is worrying the staff. Now, maybe there are always solutions. Maybe it is, as Commissioner Peach says, there's no stability. Welcome to reality. But you know, when you're a staff member and you're concerned about losing your job or things not getting done like you've agreed they should be done, I can appreciate that from the worker bee standpoint. You have a lot of pressure on you, but they do as well, and so that's why it was important to me, because I have heard it every single year that I've been on the board. So thank you very much for your willingness to take this up and have the discussions that need to be had.
I think that's a fair statement throughout all of county government. Traditionally, the administrator, the boards of commissioners have been very conservative in our projections. There have been budget cuts, there have been cutbacks. There was a period of time where staff had to work 37.5 hours. We went through 2 years of furlough days to keep people employed. There are no furlough days. Everybody's at 40. Unions have all received new contracts. So there's been a measure of stability reinstated throughout the county, and I think that that is slowly permeating the courthouse. There's a little bit better mood. And there's a long ways to go for the staff that weathered the recession, weathered the budget cuts. For those of us who are here, this is a better time, and funding is more stable thanks to the taxpayer. Since so much of our funding comes from the taxpayer directly. Thankfully, there's houses that are being sold, houses are being built, sales tax revenues up, and that has provided a measure of stability. So I think we all stay positive. There's better days, but I don't disagree. It has been a very tough time since the 2008 recession. Believe me, Administrator Jones will know. Folks don't know that he and I, during early 08 and 09, would often stay until 7, 8 o'clock at night, hashing out budget proposals. He had a lot more hair before the recession. He worked really hard to keep these programs funded, keep the courthouse open. So the board doesn't get a lot of credit for that. That's why I'm saying, let us do our job. We've got a good track record. We've got a new team. Mark and Bill are working wonderfully together. Give them a chance. We'll have new candidates this fall. We'll have new ideas. Give that a chance. Let this board focus on the presentations we've seen today and on the other issues. If you guys do that, then I'll drop the fluoride issues.
I appreciate the opportunity to continue talking about stable funding. It really doesn't matter to anyone who will listen.
Thank you, Andy.
Thank you.
You're Jim. Quickly, we're over time, but I really do want to hear about the SINAR report. If you think you can just share that briefly as more of a prelude to the future.
Sure. Yeah, I'll do a 1 minute.
Yes, and then.
So.
Fine.
So as actually Dr. Dixon was a great lead-in, because on some of those pictures, she listed the #1 most preventable cause of death in our county and state, which is tobacco use still, even though we no longer have a president. Well, I guess we do have a president who smokes, but not in an ad. Not in an ad. As part of the federal requirements to continue to keep tobacco use and tobacco prevention on the front burner, they commission the SINAR report every year. So this is a report that is done across the country that has tracked tobacco use issues since 1997. And so essentially they send out operatives who go out to all the different stores and try to buy tobacco products underage, and then they report back to us. So in Washington State, the 2015 data came out just in February, just after our last meeting. So the rate in Washington of illegal sales of tobacco to minors was about 17%, which is the highest that it's been since 1997. The state gets very, very anxious when it gets up around 20%, because at 20%, they lose funding for tobacco prevention projects. And then now the compliance checks are conducted by the Washington State Liquor and Cannabis Board. Used to be done locally, and those funds dried up. So in Clallam County, this data caught a lot of people's attention because the rate in Clallam County this year was 40%, which was quite high, the highest it's been since they've been keeping track. So we know it's a problem because most lifelong smokers are going to start before they're 18. And we know that smoking is directly connected to poor health outcomes and early death. So it's not a great piece of data that we still have lots of illegal sales of tobacco products to minors in our county.
And I think that might be something that we would come back to under our nicotine priority is this anything that we can partner with anybody else around retail sales. It seems like you're dealing with a lot less individuals. You're just dealing with the retailers themselves, some education, some emphasis put on that. I don't know. We don't have time to talk about that today, but because nicotine was one of our priority areas, I thought it was worth at least bringing this up today and thinking about it.
Can I ask one question? How do they obtain this information?
So the statewide data is they send people out who are secret shoppers, exactly, and then they try to buy, and then they issue citations right at the time. The actual county data is actually it's over-surveyed, so it's a separate additional level survey from the state data, and they're not overlapping data sets. They're separate.
But is this the secret or the same approach?
Secret shopper.
Secret.
As a community, we're serious about tobacco. I'll challenge any of you to do some homework, and I think you'll be shocked. We know that when people are arrested for drug use, the goal is to possibly get them into drug court, get them into treatment. We know that works. I think that you'd be stunned if you did a public records request to ask how many law enforcement officers have written an underage tobacco ticket in this county in the last 5 years. And I think you'd be equally stunned how many cases were referred to the county prosecutor for underage tobacco, even though it's well within any police officer's rights to write a ticket when they see underage people using tobacco. So I'm trying to figure out, and I've often figured out, and I'm one of the few law enforcement officers that ever wrote a tobacco ticket in my time in law enforcement. Wrote them all the time and never had one prosecuted in the county that I worked in. But I do know this, that if the facts about alcohol and drug abuse is to get people into the system, that law enforcement continues to turn a blind eye to underage tobacco use, and that I think we can have all the programs and all the education and all that, but if you don't have the help of law enforcement. And it's shocking to me that it is a crime, and it is not enforced. In fact, it is generally turned So I don't know how we get these kids milk. Society says it's illegal, but it isn't illegal because they can get away with it. So, food for thought.
Yeah, it's a very valuable piece of information. Thank you for sharing that.
And I'd just like to add that, one of the things that I see is a way for us to slow this is to provide alternatives to the kids, like swimming pools, like activities that engage youth, so that they develop, just listen to a conversation about nutrition, so that they develop healthy habits. And without that stimulus, this doesn't surprise me.
It is a greater reflection on what's happening in our society. Yes. Okay.
But these numbers really are based on the behavior of the retailers, the merchants. Which, so there's lots of stuff you can't control. Obviously, it's hard to control societal trends, but these are things that this is a trend that has gotten worse as funding has gone away for the sorts of operations that, when you're never going to get caught, it's not surprising that the trend is in this direction across the state.
So I appreciate you sharing this. I think it is food for thought, and I appreciate Mike Chapman, you sharing your perspectives as well, and it might be some things that we come back to. I think that Chris is not here.
Chris had to leave, and since we're running overtime, I can put my reports off till next month. This would probably be good because the report card for this year is embargoed until tomorrow. So I hate to tell you, you won't get it first, the Nutrition Coalition will get it first.
Thank you. Well, we appreciate that, and we will put all three of those items on next month. Any need for board discussion? We've discussed a lot.
I would like to discuss the action that the board took last month. I apologize to all of you for having to leave right at the beginning of the discussion. But I wish that I had been thinking more clearly about that resolution and about the lack of public notice before we talked about it. I don't know what if we met the legal requirements for public notice, but I don't feel like we met the moral requirement for public notice, and I'm just I'm curious as to if anyone has any thoughts about that, or any thoughts about how we can acknowledge that.
I promise you wouldn't bring it up.
So. You didn't bring it up, and maybe I'm the only one that feels that way, but that's why I'm putting it out on the table.
I think that our position was clear that if you just look at this from the science, it's something that's good. And that the community's wrestling with this issue of how best to implement change. Is it the case that you accept what your leaders vote on? Is it the case that the process that you're participating in is effective? I'm not sure that there's a whole lot we're going to accomplish, Mark, by bringing this thing forward for how many other reviews. Because I listened to Mike. The issue isn't anything to do with fluoride. It's everything to do with how people perceive their rights.
That's right, and I'm not suggesting that we have further discussion about it necessarily, but in terms of process, I don't know if we engaged in the right process, at least.
It wasn't fair. Let's just be honest, it wasn't fair. The public didn't know it was on our agenda.
And it also, I think there's a part of one of the results of not giving ourselves and the public sufficient time to think about it, is that the wording and the intent created a lot of confusion in the public. I had at least a dozen calls within the next day or two with people who were very confused about what that resolution actually meant. And so to the extent that the board's purpose was to underscore public policy, I don't think that we accomplished that. I think what we accomplished was in large part confusing people. And even beyond that, the way that we did it, you know, again, I don't know whether it was you know, appropriate within our bylaws in terms of public notice, but it wasn't, you know, we didn't do a good job, you know, and I'll be the first one to take responsibility for that. You know, I did not, and I don't know why, but I did not think about, like, hey, boy, the public hasn't had enough time to absorb this yet. And, you know, I think that's a problem. So, you know, if there are others who feel like, who feel similar, then I'd like to know, because then we can talk about what to do about it. And if no one else feels the same way, then I'll just, you know, my objections are, or my feelings are noted.
I'm not gonna, I won't say that I feel the same way. Right now, I'm observing, and have observed since the first of the year, that this has become a very contentious and dysfunctional group. And I think some of the conversation today makes me think, what is it that the board, this board, Board of Health, is about or should be about? And what, to Commissioner Chapman's comments, what's the division of labor and obligation, political responsibility, and public health responsibility? And I think it's just the dynamic is not well serving the community, I don't think, at this point. However we go about, whatever we need to go about. And yes, fluoride was a hot topic and is a hot topic and will continue to be a hot topic. And very wide range of opinions, but that to me isn't so much, that is an issue, but that isn't the core issue. I think it's a base function here. I think we have to come to some concurrence as to how we're going to conduct business, or what is it we're about, because I don't really think this is very functional at this point. Just an observation.
It's good to share your thoughts. Others?
They don't today.
In all fairness, Mark, it could have been added, discussed, probably shouldn't have been voted on. And we should have had it as a Board of Health. If it's a public health issue, we should have had a full airing, a full public meeting, fully noticed, so people on both sides of the issue. And we should be able to go into it with our minds open, not predisposed, but I don't think that's possible now because the board voted. So I don't think that anybody would think we're open-minded now because we've kind of registered our vote. So it was a mistake. I don't know. Yeah, it's just bad. I think we just have to be careful that the public is watching their local governments, and they want us to be transparent. They want us to be open. The Board of Commissioners has made a number of changes this year that have really changed the way we do business with the public. And I just think that this group, you know, was a mistake to have voted on it. It was not a mistake to have introduced it. I think it actually started with Bill kind of saying, hey, we should probably talk about this as a board. And I don't think he meant like talk, deliver a resolution and vote within a half hour of the first meeting. So I think that was probably, and it did. I'll tell you how goofed up it is. I had emails, phone calls, and personal contacts from people who were pro-fluoride, mad at me, and who are anti-fluoride, mad at me. Now that's how goofed up it all got. The people did not know what the Board of Health was doing. They were primarily mad because they didn't know about it. They didn't understand why it wasn't stopped. I've been called a lot of names in the last month from both sides. I have spent a lot of time talking with both sides. I've had people hang up on me. It's passions are running so high, but I literally told my wife, I said, I cannot, of all the issues, all my times in office, I've actually never had both sides mad at me equally. So I don't even know what, you know, so that's how we probably just messed up by moving it so quickly, that I think if the Board of Health had taken a step back, I don't think anybody would have changed their viewpoint on whether we should support public fluoridation, but it would have allowed the public to kind of catch up to what the Board of Health was looking at. I think that's probably what Marcus probably felt much the same frustration for people, so.
No, I think people are identifying what this board did with what the city council did. And I see a very distinct difference. This board was asked their opinion. And in fact, they were asked their opinion after there was tremendous public conversation. So, yeah, you're right, Mike, the process of having people come in and share their view is important, but that has occurred. There isn't a single person at this table that's not aware of the arguments on both sides of this issue. And, you know, I actually commend this board for not weighing in before the city council made their decision. All right? We could have easily. But I'll share with you that, you know, if I got us in trouble, I apologize. But I had people ask me a very legitimate question. What is the Board of Health's position on this? And I don't believe in stifling a response. I did not know. I got my answer. The people now have a clear understanding of what the board's position is. But you know, I come back to my leading comment. It's very different than the role that the city has. This is a group of professionals that took a position on a health issue. The city council is also looking at that, but they're certainly looking at a lot of political dimensions to what is occurring. So I considered very separately, you know, they may in the future reflect on what this board decided, but they made their decision before this board. And we had all the information that they had. So I don't feel bad, Mike, about the fact that that somebody didn't come in, because there were some people that did, and share, here's how I feel. I just think that there was a tremendous amount of opportunity for just exactly that to occur. And quite frankly, I would prefer not to have the kind of interaction that has occurred at City Hall. I've been to those meetings. I was appalled. I was actually a little concerned about my safety. Should something break out, because there's a lot of people, emotions ran really, really strong, and I just looked at it and said, that council's making a political decision, period. We made a scientific decision. It's very different.
Any further discussion?
Under Robert's Rules of Order, a member of the Board of Health who voted in affirmative would have to ask for reconsideration. So since you didn't vote and I voted no, it would take one of the other 5 members to bring it back for reconsideration. So it doesn't sound like that's going to happen. Should, but probably won't. And we should have, I somewhat, I respect the science from both sides. And it's interesting that just in the last, hey Cindy, when did that state law change that you sent us yesterday?
Last week.
So just in the last week, the State Board of Health has now lowered the threshold for fluoride. So the science...
They're catching up to what, something the CDC did a number of years ago.
So is that not the case that science is changing?
No, the amount of ambient fluoride in the environment is right from other sources. Right. But I'm just saying that, like, I don't really want to get into any of this, but I'm just saying that action by the Washington Board of Health is catching up to a recommendation that was made way a bit before that by the CDC, and that Port Angeles, for example, had already made that change when it first came out from the CDC. It's just that Washington Board of Health hadn't gotten to making the change.
My point or question is, in my lifetime, a lot of science has changed. And I lost my tonsils because when I was a kid and I had a sore throat, the science at the time said to take my tonsils out. Both of my boys had the same sore throats. And when we took them to a doctor, I said, I suppose you're going to take their tonsils out. The doctor looked at me and said, we don't do that anymore. So both of my boys have their tonsils. So some of the conversations I've had is that it is easy to rely upon science, but it is also very proven that science changes over time and facts change. So I don't think that, though, and I am one, I appreciate people who think fluoride in the water is a great thing, but I don't think we can just say the science proves it, because the science proved when I was a kid, my tonsils out. Why didn't my kids have their tonsils out? There's lots of things that science changed, and you guys are scientists. I am not a scientist, but as I have read over my, things have changed in my lifetime, so I don't know. Now parts of fluoride are being lowered. We now know there's more fluoride in our natural water. So it behooves anybody as a policymaker to be open-minded to changing science. I believe that's the society we live in. In fact, when people are not open to changing science, we say we have all kinds of names for them that they linger when they don't. So that's all that is.
Thank you, thank you. We will move the, we have on future meeting items, the children's special health care needs, changing format of BOH minutes, then the 2 items from the health director's report, and the naloxone distribution program. We have public comment, and we still have public here.
Yeah, we still have public here. I need time to put my presentation together, and I'm willing it won't take you but 2 hours. So I'll address you now.
Okay, thank you very much. Is anyone else interested in sharing their thoughts at this point? Then, with no further public comment, I would welcome a motion to adjourn.
So
All in favor, say aye.
Aye.
Thank you very much.